of all Americans. He comes well equipped to do an excellent job, and personally, I am very proud of him. So it is with great pleasure that I am here both to endorse and to support his candidacy. Thank you, Mr. Chairman.
Thank you so much, Senator Feinstein. Great to have you with us today. And now we'll turn to Senator Padilla for his introduction.
Thank you, Chair Murray, Ranking Member Burr, for inviting me to address the HELP Committee today to also introduce my friend, California Attorney General Xavier Becerra. It's indeed an honor to introduce a fellow Californian for this important post. Our nation is going through one of the toughest times we have faced in recent memory. The COVID-19 pandemic has taken an incredible toll on our lives and on communities across the United States. As we all know, COVID-19 deaths in the United States just surpassed 500,000 people. The devastation has disproportionately impacted working-class communities and communities of color, very similar to the very neighborhoods that Attorney General Becerra and I grew up in. These communities are hurting and dying at alarming rates, and they desperately need someone who knows these communities to their core. The Los Angeles Times just published an article on Saturday showing the disparity in vaccination rates across Los Angeles County, just for example, where wealthy neighborhoods like Beverly Hills are being vaccinated at 5 times the rate of minority communities, such as South Los Angeles. That's why I'm honored to introduce Attorney General Becerra today as the nominee for Secretary of the Department of Health and Human Services. If confirmed, Attorney General Becerra will be the first Latino Secretary of Health and Human Services, an honor I know he will not take lightly because it won't just be an honor. He views it as a tremendous responsibility. Throughout his upbringing and time as a public servant, Xavier Becerra has shown his passion for people and his commitment to improving the lives of those he serves. As you've heard, his parents immigrated from Mexico, just like my parents did, with the dream of building a better life for themselves and their family. As Senator Feinstein mentioned, Attorney General Becerra was the first in his family to graduate from college, earning both his undergraduate and law degree at Stanford University. While at Stanford, he also met his wife, Dr. Carolina Reyes, a widely respected obstetrician who helps care for women with high-risk pregnancies in underserved communities. Attorney General Becerra's first job out of law school was working with individuals with mental health disorders, a health issue that is too often overlooked, especially in communities of color. He also worked for a time at the California Department of Justice before serving in the California State Assembly. He was elected to Congress in 1992, where he quickly gained and maintained a reputation for being a strong supporter of reproductive health, protections for seniors, mental health parity, and the Children's Health Insurance Program, which we refer to as CHIP. And yes, Xavier was also instrumental in drafting and passing the Affordable Care Act, which has helped provide access to quality health care for millions of Americans who were previously uninsured. But his work has not stopped there. As Attorney General of California, he's made it his mission to tackle structural inequalities within our healthcare system. Attorney General Becerra was the leading force behind the lawsuit to protect the Affordable Care Act and to maintain protections for people with pre-existing conditions and for those suffering from a mental illness. Over the past year, Attorney General Becerra fought to protect frontline healthcare workers from further exposure to COVID-19, and he stood up for homeowners struggling with their mortgage payments. I know public service is not just a job for Xavier. This is a commitment to honor the sacrifices of his parents and an opportunity to bring greater equity, greater opportunity, and greater hope for all Americans. Javier is a proven leader who is uniquely qualified to take on the challenges of this moment with a vision of equity and compassion. I urge the committee to support his nomination. Thank you.
Thank you very much, Senator Padilla. Great to have both of you here today. And now, Attorney General Becerra, welcome. Thank you so much for being here today. We are looking forward to hearing from you, and you can now begin your testimony.
Thank you, Madam Chair, Ranking Member Burr, and members of the committee for this opportunity to speak to you. To Senator Feinstein and Senator Padilla, special thanks for your kind introduction. I also wish to thank my family, my North Star, Dr. Carolina Reyes, who is here with me, and our daughters, Natalia, Olivia, and Clarissa's husband, Ivan. Everything I do, including this, is a family affair. I am here because my parents, Manuel and Maria Teresa, who had only their hope and health when they settled in Sacramento, taught me to earn the American dream. A construction worker with a sixth grade education and a clerical worker who arrived in her teens from Guadalajara, Jalisco, Mexico, they never saw the inside of a college classroom, but they sent all their kids to one or to the military. We lost my dad last year on New Year's Day. When the end came, my dad knew we were there with him, at his side, in our home. Sadly, hundreds of thousands of Americans haven't had that closure this past year. That, senators, is why I'm here today. The COVID pandemic has killed 500,000 Americans, many of them alone without their families. Millions more have lost their jobs and health care. That is not the America my parents would believe possible. To meet this moment, we need strong federal leadership. That's what President Biden is demonstrating, and I'm fortunate to be confirmed. I look forward to joining the President in this critical mission. I understand the enormous challenges before us and our solemn responsibility to faithfully steward this agency that touches almost every aspect of our lives. I'm humbled by the task, and I'm ready for it. The mission of HHS, to enhance the health and well-being of all Americans, is core to who I am. When I was a child, my mom had a health scare. She was rushed to the hospital after hemorrhaging at home. The image is seared in my memory. We were lucky. My mom is now 87 years young. Better put, we were blessed. My dad, the laborer, had insurance through his union, Laborers Local 185. We didn't have much, but we didn't have to face the threat of unpaid medical bills or even bankruptcy. Over 2 decades in Congress, I worked to ensure every family had the assurance of care that mine had. I helped expand the Children's Health Insurance Program. I helped write and pass the Affordable Care Act. From the Ways and Means Committee, I fought to strengthen and modernize Medicare and how we finance it. As Attorney General, I created a Healthcare Rights and Access Unit. We cracked down on Medicare and Medicaid fraud. I've worked to hold opioid manufacturers accountable for the addiction crisis. I've taken on hospital and drug makers who unfairly jack up prices on patients. I have protected patients' privacy. If confirmed, I'll work with you to continue this type of work and to address HHS's biggest challenges. And that, of course, starts with COVID. The President has ambitious goals: 100 million vaccine shots in arms in his first 100 days, increasing access to testing, sequencing the virus so we're prepared for the variants, reopening schools and businesses. HHS has a central role in meeting all of these goals safely and equitably. As Attorney General, I saw the importance of this on the front lines. I worked with my colleagues in other states, both Republicans and Democrats, to make COVID treatments more readily available. I am ready to work with you, with our state and local partners, and across government to get this right. Next, we must ensure people have access to quality, affordable health care. If confirmed, I will work with you to strengthen our Medicare and Medicaid lifelines, to reduce the cost of health care and prescription drugs, and ensure we are accountable, spending resources wisely and effectively. And I won't forget the other H in HHS, Human Services. I want to work with you, supporting our vulnerable children, those in foster care, strengthening Head Start, and expanding access to child care. Finally, we must restore faith in our public health institutions. That starts with putting science and the facts first and showing respect for our career workforce. No one understands your state and your communities better than you. We may not always agree, but if I'm fortunate enough to be confirmed, I will always listen to you. I will keep an open mind. I will look for common cause, and I will work with you to improve the health and dignity of the American people. I want to thank you for this opportunity to share my vision.
Thank you very much, Attorney General Becerra. We will now begin a round of 5-minute questions, and I ask all of our colleagues, please keep track of the clock and stay within the 5 minutes. We have a lot of senators today, 2 votes. I'm happy to stay if any of you have additional questions for a second round, but I'm going to try and keep us all to within the 5 minutes on the first round. Since this pandemic began a year ago, more than 28 million people in our country have been diagnosed now with COVID-19, and 500,000 more than have died. It's a tragedy made worse by a failure in leadership. The Trump administration's denial of the severity of this emergency and its constant attempts at political interference devastated public health and eroded public confidence. The Trump administration refused to stand up an adequate testing strategy. They demanded FDA authorize unproven COVID-19 therapeutics. They left states and tribes to compete against each other for limited supplies. They failed to provide sufficient guidance to our schools and workplaces and elevated conspiracy theories and muzzled scientists. They rejected science and misled the public throughout that response, exacerbating existing racial and health inequities. Even with vaccines, we saw delays in early vaccine deliveries and false information about available supply, lack of communication between federal, state, tribal, and local officials, and now the nation faces more major challenges with vaccine confidence, the inevitable outcome of political interference and false information. We need a strong federal response, driven by evidence, with a comprehensive national plan. So my question to you, Attorney General Becerra, is if you're confirmed as Secretary, will you empower HHS's scientists and experts to be leaders in the nation's COVID response?
Madam Chair, thank you for the question and the work that you've done in all of these efforts to move us forward. And I completely agree with what you've said. Science must come first. We must ensure that people trust what we say. We have to earn their respect and their trust. We want them to participate in the vaccination program. We want them to continue to mask and socially distance and to wash their hands. And so, absolutely, I look forward to working with you to make sure that we gain that trust of the American people, and we do it in a transparent way so that at the end of the day, people know that when we took action, it was because science demanded it.
Good. I appreciate that. And as you know, I pushed the Trump administration hard for a detailed vaccine plan for 6 months. And I'm really glad the Biden administration is taking that challenge seriously now. So we need to work together to make widespread vaccination a reality. I wanted to ask you, what can we do to make sure there's a widespread trust and confidence in COVID-19 vaccines?
Well, Senator, as I mentioned, what's probably most important is that people believe that what we are asking them to do is the best course of treatment and action for their health. And we have a ways to go to regain the trust of the American people. But if we let the experts, as we said, the scientists lead, I believe soon people will see the results. And if they see the results, we know they care about their families and their loved ones. No one wants to see the number of 500,000 grow in the number who have died. And so if we're transparent, if we show accountability, if we do this in a way that earns their respect, we will make progress, and we will make it swiftly. And I thank President Biden for his ambitious goal, 100 million shots, vaccine shots, in 100 days, moving forward to try to reopen the majority of our K-8 schools. safely. All of those goals are critical goals, and I look forward to working with you if I'm fortunate to be confirmed to make it a reality.
Good. And in addition to knowing they can trust their government to respond effectively to a crisis, people should also be able to trust they have the health care available to them when they need it. You have been a leader in the fight to bring affordable, quality health care to everyone. And over the last 4 years, as we know, the Trump administration didn't just attempt to repeal the ACA through Congress and to attack it in court, jeopardizing coverage and protections for people with pre-existing conditions. It also sabotaged the law through executive action, issuing rules that made healthcare harder to get, more expensive, left patients and families paying for more costs out of pocket, and stuck with junk insurance plans. We have a lot of work to do to reverse the damage and get people the care they need. So will you work with us to help ensure everyone has access to quality, affordable health care?
Madam Chair, I can guarantee you that that is part of my core in what I have done. My father used to tell me the stories of when he was a young man, how he could not walk into establishments because of the signs that said no dogs, Negroes, or Mexicans allowed. My father was a U.S. citizen, and those stories are in my mind. That is one of the reasons why I have always fought to make sure that we are inclusive, whether it's inclusive based on race or ethnicity, but geography. Rural Americans are entitled to know that we are counting them as well. And so I look forward to working to make sure that we close all gaps and reach every corner of our country to make sure everyone is safe from COVID.
Thank you very much. My time has expired. I will turn it over to Senator Burr.
Thank you, Madam Chairman. I'm going to save my questions to the end of the hearing, so I'm going to yield my time to Senator Collins.
Thank you, Senator Burr. Welcome, Attorney General Becerra. I want to talk to you about our nation's schools. About half of K through 12 students are still not spending any time in classrooms, with resulting losses in academic achievement, literacy, social and emotional development, not to mention the stress on their parents. Experts tell us that these extended absences are causing large learning problems, especially for lower income students. In a recent op-ed in the Washington Post, two public health experts were critical of the new CDC school reopening guidelines. They suggested that while you need 6 feet for adults, that it is safe, if you have masks and other procedures, for students to only be kept 3 feet apart. It's not just these public health experts. The American Academy of Pediatrics has similarly said that schools should weigh the benefits of strict adherence to the 6 feet spacing rule with the potential downside if remote learning is the only alternative. So my question to you is this: won't maintaining this 6-foot recommendation, despite these very credible alternative views by healthcare experts, prevent many schools from resuming full-time in-person learning this year and possibly even into next year? And keep in mind, some of these students have not been in school since last March.
Senator, you posed the question that's on the mind of parents throughout this country every day. The preeminent concern must be the safety of our families. No one wants to risk the life of their child, and certainly no one wants to have a child become the reason an adult becomes ill from COVID. And so I will tell you what I believe is the best approach, and that is to let science guide us and let the experts determine when it is safe. Remembering that schools and education are a local issue, and where the federal government has a partnership, we provide the guidance. We should not be the ones making the final decision on how and when a school will reopen, because those are local decisions. But we must work with them and provide the guidance, the support, the resources to make sure that those schools do reopen as soon as possible and as safely as possible. So I can commit to you that I will work with you and leaders in Congress, but especially local leaders in our school districts to make sure that we have provided the partnership they need to know when it's safe to reopen their schools for their kids.
Well, I would suggest that the American Academy of Pediatrics is suggesting the harm, these other public health experts that we need to broaden who we're listening to. Let me, in my remaining time, switch to another issue. As chairman of the Senate Aging Committee, past chairman, I held the first congressional hearing on the impact of COVID on seniors living in nursing homes and other congregate care settings. And I've heard from numerous healthcare providers about the difficulty and expense of paying for additional staff and COVID-related facility improvements, PPE, et cetera. In my state, more than a dozen nursing homes have closed in the past 6 years, and many more are struggling to keep open. I was astonished that in a $1.9 trillion COVID package, the administration did not include any money for a provider relief fund, which would help these nursing homes. Do you support providing additional assistance to long-term care facilities, our rural hospitals, community health centers, and other providers?
Senator, thank you for the question, and I know how hard you worked on these matters. I will tell you that I absolutely, I can tell you that as if I were fortunate to be confirmed, that it would be a top priority to make sure that we are providing the resources necessary. We've seen how so many of these assisted living facilities, nursing homes, and other facilities that care for aged and disabled Americans haven't had the resources. They're short on workers. And we've seen the crisis of COVID hit them hardest. And so we have to provide the help. And I believe it's important, and I believe President Biden will be there to provide the support, whether it's through the Provider Relief Fund or simply by making sure that we are providing resources that are already allocated to make sure that we're working closely with those facilities that have been hit the hardest.
Thank you. There's an excellent proposal in the package that 10 Republicans presented to the White House that I hope you'll take a close look at. Thank you, Thank you, Senator Burr. Senator Murray.
Thank you, Senator.
Thank you so much. We will turn to Senator Sanders.
Thank you, Madam Chair. And Mr. Attorney General, welcome. Let me start off by stating what you already know, that the United States is the only major country on earth not to guarantee health care to all people. Today, some 90 million Americans are either uninsured or underinsured. And despite that, we are spending twice as much per capita on health care as do the people of any other nation. And on top of that, we pay by far the highest prices in the world for prescription drugs, resulting in 1 out of 4 Americans not being able to afford the medicine that they need. So my first question is, what are you going to do, if confirmed, to move this country forward to provide health care to all people and also substantially lower the cost of prescription drugs?
Senator, thank you very much for the question and for your tireless commitment to making sure all people in this country have health care. I believe President Biden made it very clear. If we work hard to build on the Affordable Care Act, and if we continue to make improvements, we will get to that point where we will finally, as the leading nation in the world, be able to say that we truly do cover all of our people. No one should have to experience what I saw as a child when my mom was whisked away to the hospital, not knowing if they'll be able to afford the care. And I believe that we are moving in that direction, and President Biden is committed. He has said, without mistake, that we are going to build on the Affordable Care Act, and that is what I hope to do. And in that regard, Senator, I have to mention that I think there is unanimity, bipartisan support for tackling the high cost of prescription medication. And I can assure you that that will be one of my priorities, is to deal with it swiftly. I've tried to tackle it as the Attorney General. I tried to work on that when I was in the House, and I look forward to working with you and members of this body in the future.
Could you give us any more specificity as to how we lower the cost of prescription drugs? Because the truth is, members of Congress have been talking about this issue for decades, and yet the pharmaceutical industry is enormously powerful. They make huge amounts of campaign contributions, spend billions over years on lobbying. They don't often lose, and they continue to be in a position where they can charge Americans any price they want. In case of insulin, for example, we pay 10 times more than our neighbors in Canada do because we have no regulations over them. Can you give us a little bit more specificity as to how we take on the drug companies and lower prescription drug costs?
I think, Senator, we can all agree that the price that we're paying for some of these prescription drugs is far higher than it should be. All you have to do is travel to another country, whether Canada or another country in the world, to find that we're paying way more than some of these, the people in some of these countries are paying. And I took on a number of the pharmaceutical companies, the drug makers, by trying to go behind the curtain of how they reach their pricing. And we were able to prove that there is collusion at times going on. There's a process called pay for delay, where companies will essentially collude with each other to not have a second company put a generic product on the market to compete with the brand name product, and therefore keeping the price of that brand name pharmaceutical product high. We were able to succeed in going behind that curtain and trying to undercut that type of antitrust activity. We can also
let me just jump in. Mr. Attorney General, in the midst of a dysfunctional healthcare system, our primary healthcare system is awful in the sense that many, many millions of people, even those with insurance, can't find a medical home, can't find a doctor when they need to. Are you supportive of a significant growth in federally qualified community health centers around this country so that we can make sure that every American, regardless of income, has access to decent quality health care?
Senator, absolutely. That is one of the ways that we were able to reduce by almost 1/2 the uninsured rate in my former congressional district after the implementation of the Affordable Care Act, because our community health centers were there to be supportive of people who didn't have access to hospitals and doctors previously.
Well, in a similar vein, we have a crisis in that we do not have enough healthcare providers, doctors, nurses, others in underserved areas, whether they're urban or rural. Are you supportive of expanding the National Health Service Corps?
Absolutely as well. And here I want to thank the work that you and the members of Congress have done to increase the number of graduate medical education slots by about 1,000 that will be available throughout the country, so we can place these future doctors in places where they're needed most, in some of our rural communities, in some of our inner city communities, making sure that we're meeting the need of people moving forward.
We recently learned some shocking information that life expectancy in the United States as a result of COVID has gone down. For the African American community, it is unbelievable in terms of what we're talking about, because averaging 2.7 years decline. What can we do to make sure that we improve access to minority healthcare access to minority communities in this country?
Senator, as you know, I've worked a long time on these issues, oftentimes with you and others who believe that we should not have the gaps in our healthcare system, that we miss far too many communities too often. And what I can tell you is that if we collect better data that helps us understand where the shortages are, who we're missing, we'll also be able to then provide better treatment. And so first thing is we need to make a better effort at collecting the data that we need. I do want to thank the scientists and experts who made sure that when we're doing the studies for the search of a vaccine, the studies did include some of these oftentimes forgotten communities in their trials. We also have to make sure that we are reaching out. And sometimes the best way to reach out to some of these communities is use the local, civic, religious leaders that are trusted in that community, so we can make sure we're not missing anyone. And so I look forward to working with all of you.
Okay, Madam Chair, thank you very much.
That we deal with health disparities.
Okay.
Thank you.
Thank you so much, Senator Cassidy.
Hey, General, nice to see you, and thank you for that visit we had on the phone. Now, I echo what Senator Burr said, which is that I'm concerned that, I mean, you're a very highly trained attorney, great, impeccable credentials. I'm a physician. What would you as the attorney think if I, the physician, were nominated to be the United States Attorney General as opposed to Merrick Garland? You would say, the guy's not qualified. Maybe HHS Secretary, maybe not, but certainly not Attorney General. So you can imagine the kind of concerns I have regarding your nomination. But that said, as Senator Burr said, I have an open mind and just want to go through it. So I'm just going to talk about some of the things that we've talked about on this Health Committee and see what your thoughts are, and to give us a sense of comfort about, the training that you bring. A huge issue has been the 340B program. We've had at least one, maybe two or three hearings on this since I've been a senator. And it's big stakeholders, all of them claiming that they're totally righteous, and the truth being somewhere in between. So in that, two key questions. Do we need a statutory definition for contract pharmacy and a statutory definition for patient? If yes, what would those definitions be? And by the way, you may not have thought about this, so I get that. I'm not going to ask you the entire breadth of HHS, just some different sort of questions, and I will be at Finance tomorrow, just to kind of let us know the degree to which you're prepared for this job.
Senator, thank you for the question, and thank you for the opportunity previously to sit with you and discuss some of these matters. 340B is an indispensable program for some of our most underserved communities. I know you know this, but for the public that may not understand what the 340B program is, it works with our safety net providers to make sure that some of these forgotten communities have access to some of the essential medications that they need for a reasonable price. And so what we must do is make sure that the law is followed. Your question asks if we should have a statutory definition for contract pharmacy or for a patient. I think the first thing we have to do is enforce the laws that we have in place.
Now, let me say, though, that the law currently does not have such statutory definitions. So do you think it important that they have them? If so, how would you define it?
Senator, I'm more than willing to work with you and members in Congress, if I'm fortunate to be confirmed, to see if we have to move in that direction. But we've had the 340B program for a while.
That is a process. I guess I'm asking more than a process question. I'm asking either a philosophical or, yes, I am familiar enough with the program to have an opinion on it question.
Well, Senator, what I'm hoping to say in response to your question is that we've had the program in place. It was only recently that we had an issue arise from the drug makers saying that they wanted to change the way it operates. We had the previous administration issue an advisory opinion that said that the program should move forward as is. And
General, I have limited time, so I'm going to move on, because actually when I was in the House with you, probably 8 to 10 years ago, industry was raising the issue of 340B as an issue. It's just, so just to say that. Let me ask you again, Senator Sanders asked about diabetes, very expensive condition. Some stakeholders suggest that we counter insulin price increases by requiring health plans to pass 100% of all rebates on to patients. What would be your thoughts regarding that?
Senator, I do believe, and thank you for the question, that we must continue to see the cost of prescription drug medication go down, especially some of these life-saving treatments where people don't have a choice. I do believe the rebate program must be enforced. I also do believe that we have seen instances where there have been providers, there have been folks who have not followed the law. And I will tell you that you can't play a game with indispensable
but specifically, drugs. Should 100% of rebates be required to be passed back to the patient?
What I will say to you, Senator, is I will look into that, and we're more than willing to work with you. Right now, we have a proposal that I believe was rushed out that would in many ways, take sides in this debate, and I would simply say that we have to protect the Part D program for our seniors and do it the right way. And so I'm more than willing to look at this program if I'm fortunate to be confirmed and work with you on it.
Thank you, Attorney General Becerra. I yield.
Thank you, Senator Cassidy. Senator Casey.
Chair Murray, thank you very much for your leadership of this committee and this hearing, and I want to welcome Attorney General Becerra and thank him for his willingness to continue public service, not only to the people of his home state up to this point in time, but to the people of our nation. Mr. Attorney General, your story is a great American story, the story of your own success and that of your family, your parents, and we're grateful for that commitment to public service. Secondly, I think you're well prepared to lead this critical agency during a time of crisis, the worst public health crisis in a century, and of course, a jobs and economic crisis. If you would excuse my long predicate to my question, but I want to get a few things on the record, dealing with an important piece of legislation that both Chair Murray and Ranking Member Burr worked with me to pass, the Pandemic All Hazards Preparedness Act. In the last reauthorization, we extended a National Advisory Committee on Children and Disasters. That was a good step forward. We also created two new National Advisory Committees, one on seniors and disasters and a second National Advisory Committee on individuals with disabilities and disasters. The National Advisory Committee on Children and Disasters provided valuable recommendations to the federal government since it was first established in 2013 to respond to different types of emergencies that can impact children. In 2019, we passed the most recent reauthorization of Pandemic All Hazards Preparedness. We included two additional advisory committees for those populations that are frequently left out of disaster planning, both seniors and people with disabilities. It's been a source of real frustration of mine that the last administration took no action at all to stand up these two national advisory committees, one on seniors and disasters and the other individuals with disabilities and disasters. Additionally, despite having the infrastructure in place, the Advisory Committee on Children and Disasters, the original advisory committee, has also not been reestablished despite a call for applications last year. In a pandemic where both seniors and people with disabilities have been disproportionately and adversely impacted, both have been overlooked, and at the same time, children's daily lives and their education has been disrupted. We've got to take action to make sure these advisory committees are up and running. So my question is really simple. As Secretary, upon confirmation, will you ensure that the department is fulfilling its obligation under the law to establish and maintain these three advisory committees?
Senator Casey, thank you for the question and all the work you did on PAPA, along with some of your colleagues. You had me at hello on this one. Absolutely. On these advisory committees, we need to move forward. My first job as an attorney was representing Americans who needed disability services. I established a Disability Rights Bureau at the California Department of Justice. We have a very aggressive and active Children's Justice Bureau in the California Department of Justice, which was established by now Vice President Harris. And so I will tell you that on this, I look forward to the partnership if I'm fortunate to be confirmed.
Thanks very much. My second and final question, in the interest of time, is throughout your career, you've been interested in the question of social determinants of health and how the lack of life-enhancing resources, whether it's food or housing or education or healthcare, are considered to be among the root causes of the health disparities we've heard so much about. When you were in the House, we worked together on this, and I know you've worked with other members as well. We've seen how COVID-19 poses a greater risk to people with pre-existing conditions, as well as especially to Black Americans and others who live in communities of color. And this has shown us we still have a lot of work to do on these issues. Can you speak about your interest in social determinants of health and how your work over the years will instruct your efforts to address the health, racial, and ethnic disparities that confront our nation?
Senator, well, first, it was a pleasure to work with you on the Impact Act and dealing with these social determinants of health and trying to address disparities. We've gone a long way from those early days. We know we need the data. We know we have work to do to fill those gaps. And I'm just thrilled to see that so many members, both sides of the aisles, both chambers, are working towards addressing health disparities. And I look forward to continuing the partnership I had with you previously and with the members on this committee.
Thanks very much. Thank you, Chair Murray.
Thank you very much, Senator Murkowski just arrived. Are you ready to go?
Senator Murray, recognize Senator Murkowski next.
Thank you. I couldn't hear her, so I wasn't sure where we were.
Okay, I'm on. Can you hear me now?
Yeah, we're recognizing Senator Murkowski next.
Yep, that's what I said. Sorry, my mute was
Thank you.
Thank you.
Thank
Murkowski.
Thank you. And welcome to the committee. I appreciated our discussion some days ago and the opportunity to drill down just a little bit further. I mean, you come to this nomination with the background and the experience that you've had over in the other body. You are one who comes from a pretty urban area. We've had an opportunity to speak about some of the specifics that are Alaska specific, but more broadly to rural itself. And as a member of this committee, as health matters are brought to bear, I always will ask a question, many questions about rural health care, along with Senator Collins here, and so I'll start with that generally. You represented a population-dense urban congressional district, so as HHS Secretary, how will you champion policies to provide what we both acknowledge is sorely needed with regards to health care in both urban and rural parts of the country? And specifically, how do you make sure that we have adequate representation when it comes to the priorities of HHS, when it comes to accessing rural health care? Because our challenge is access to the care. And when you don't have access to the care, it's costly and just very generally challenging.
Senator, first, thank you for that opportunity to chat with you previously, and I enjoyed your laser focus on these issues, and I think it's appropriate. The challenges that the folks in your state face are unique to rural communities. Other states face it, but I think, as you explained so well, even for Alaska, sometimes it's unique even among rural communities. And I will tell you that what we must do is make sure that we are prepared to meet those unique needs, whether it's the workforce, oftentimes we forget about that, the transportation obstacles that folks in the state of Alaska will face, dealing with broadband, just making sure there's access. Telehealth, I know, has become very important. We discussed that as well. Let me tell you that the most important thing I can do is try to assure you that as much as the needs in rural America are unique, I always would tell folks when I was a member of the House that while I represented one of the most densely populated areas of the country, we had some of the greatest disparities. We didn't have to travel 1,500 miles to find the disparities. We could just travel 15 miles from East Los Angeles to Beverly Hills to see the disparities that existed. But again, rural communities do face a different challenge. 15 miles is very different from having to travel 1,500 miles in one state. And so I will say to you that what I should do more than anything is, if I'm fortunate to be confirmed, is take you up on that invitation to go to Alaska to see firsthand the challenges that the people in Alaska face.
Well, I would encourage that, and I would encourage that visit early. One of the areas where we have, I think, been innovative with regards to distribution of the COVID-19 vaccines that are out there is how through the IHS we've really been utilizing the experience of a distribution system that has been set up, and just again an ability to just make things happen, not because we're following somebody else's guidelines, but because we know the need is there. So you're going to be making some pretty key decisions with regards to funding allocations for provider relief, for testing, for vaccine distribution. And what I've been hearing from folks back home is when we get the vaccine, we are really good at pushing it out. In fact, we're number one in the country right now in terms of percentage of Alaskans that have been vaccinated. But I would ask for your support to make sure that when these funding allocation decisions are made, that funding for rural areas is going to be prioritized as well.
Senator, I know that you and Senator Manchin are working on legislation to do just that. And as I said to you in our conversation, I commit to you, I'll be at that table talking with you and those who understand these unique needs of rural America. The last thing I need is to be one who doesn't address these disparities in an aggressive manner. As I said, I'm fortunate that my mother is now 87 years of age. Most people in my neighborhood at that time did not have health insurance. They probably would not have survived such a difficult time seeing your mom whisked away to the hospital. So absolutely, I'm committed to working with you to make sure that we do, whether it's through resources or through the workforce, providing the type of services that are needed in rural America.
One thing about COVID-19 is we have really shown a spotlight on where these health disparities are.
Yes.
And focusing on those in rural areas, I think, is key. Thank you, Madam Chairman.
Thank you, Senator Murkowski. I think we all agree on that. Thank you. Senator Baldwin.
Thank you, Chair Murray. And again, General Becerra, welcome to the Health Committee. It's always good to see a familiar face from our days working together in the House on the Affordable Care Act. As Chair Murray indicated in her opening statement, the previous administration never put a priority emphasis on public health. They did not work to protect those with pre-existing health conditions. In the midst of the COVID-19 pandemic, the previous administration actually doubled down on their efforts, many different efforts to sabotage our healthcare system, actively seeking to overturn the Affordable Care Act in court. As you know, this particular court case threatens to take away coverage to millions of Americans. People like a constituent of mine, Kirsten from Green Bay, Wisconsin. At 11 days old, she was diagnosed with a serious heart defect, and she was airlifted to Children's Hospital in Milwaukee, Wisconsin, to undergo closed heart surgery. Kirsten is now 24 years old, and because of the Affordable Care Act and the nearly 20 operations that she's undergone, she's had coverage. And she wrote to me, all of these procedures are the reason I'm alive today. Health care should be a right for all Americans and not a privilege for the few. I couldn't agree more. So I think I wanted to start with two sort of overarching questions before digging down into some more specifics. As HHS Secretary, we have basically to provide greater access, we have to not only repair the damage, but also to build back better with our healthcare system. So I'm asking, what are the key ways in which you would strengthen our healthcare system after the damage that's been done in the previous administration? What would you go after first? And then how would you work to build back better in ensuring even more people have access to affordable, quality healthcare coverage?
Senator, thank you for the question, and great to see you again. And I hope if all goes well, and I'm fortunate to be confirmed to once again get to work with you as I did for so many years when we were both in the House and when you went to the Senate. Let me tell you that I can just take the words of our president himself, because he too has said healthcare should be a right, not a privilege. And that's a great place to start if you have the most powerful person in the world saying that. Secondly, he's, as you mentioned, said that we must build on what we've had with the Affordable Care Act to make it stronger, to provide better quality care at more affordable prices. And two of the things I can tell you right off, one is something that the administration has already moved on, and that is to have an open enrollment period, a special open enrollment period for Americans who've lost their insurance or who never had it. And right now during COVID, this is the worst time to not be insured. So the open enrollment period will give a lot of Americans, millions of Americans, a chance to get covered again. Secondly, as you know, because I know this is important to you and members in the Congress, is we got to deal with this cliff that so many Americans face, that when they're in middle-class status, if they happen to get a little too high in their income, and high, it doesn't mean high, just middle class, maybe you got a pay bump after last year, all of a sudden you find that you fall off this cliff when it comes to the tax credits that are made available to you under the Affordable Care Act to help you afford your insurance plan under the market exchanges in the Affordable Care Act. We've got to do something to address that cliff that too many families are facing to make Affordable Care Act a reality for more families. There are any number of things that I know you've worked on that we can look at, but I want to just mention at least those two principal ones, and if you'd like, I could go further.
Thank you for that. I wanted to get into a very specific area of the COVID-19 pandemic, and that's increasing. We know at the start of the pandemic, increasing our ability to test was essential to our ability to track down and slow the spread of the virus. The same is true for funding and tracking variants that we find now emerging. We can't afford to make the same mistakes we did at the early stages where testing was virtually unavailable. I've introduced a bill to assist the CDC with resources and to support its needs to dramatically scale up sequencing of coronavirus mutations. As HHS Secretary, how would you ensure that all of our federal health agencies are working together to do their part and take on the next phase of this pandemic at tracking the emergence of these mutations?
And I know that the time is short to respond, so I'll just say it very quickly. One, we need to coordinate much better, whether it's with the Department of Labor when it comes to people who have insurance through their employer and what happens if they happen to lose their job, whether it's working with the Department of Education when it comes to the issue of how we reopen our schools. We need to just coordinate much better. And I will tell you this, we have to be transparent. We have to use data to drive our decisions. We have to let the American public understand how we do that. And if we do it right, people will have faith that what we're proposing will work. And I look forward to working with you and your colleagues to make sure that we have a partnership with the American people because they believe we know what will work.
Thank you.
Thank you, Senator Baldwin. Senator Braun.
Thank you, Madam Chair. Enjoyed our lengthy conversation when we visited the first time. I think it went well over a half an hour. And I want to get three questions. So I want to tell you that up front. But for many of us, your record has been as very extreme on abortion issues. Other pro-life groups, have put a lot of information out there that basically you've been against pro-life on the record. Also some issues with religious liberty manifesting itself in where you actually took to court Little Sisters of the Poor. I'm not going to go into the detail of that. I think that says enough. But I do want to ask you this question. If you're get through the proceedings intact and you are the HHS Secretary, you're going to be representing everyone. And this is a very succinct question to the point. Will you commit to not using taxpayer money to fund abortions and abortion providers?
Senator, if I first can start by saying thank you very much for the the lengthy conversation we had. I definitely appreciate it. And while we probably will not agree on all the issues, I can say to you that we will definitely follow the law when it comes to the use of federal resources. And so I can make that commitment that we will follow the law.
Not really the particular answer I was looking for, but I'll take that because I want to move on to the next question. Operation Warp Speed. I'll never forget in the early discussions we had with the FDA, CDC, there was squabbling within the bureaucracies about how we were going to get this effort made that we all knew even at that time with the peculiarity of the disease that was going to be the real light at the end of the tunnel. Being an entrepreneur, knowing how the business world works, knowing that pharma has been so stodgy with its record in terms of coming to the forefront with new cures and so forth, mostly impeded by some of the regulatory impediments. Will you acknowledge that that was probably the most important variable in this whole tough journey with COVID-19, that we broke the paradigm of how things normally work by galvanizing, pharma to come up with vaccines that took basically 1/4 to 1/5 the time, predicted before?
Senator, let me agree with you that had it not been that we essentially knocked some heads and said everybody's got to come to the table, and it had to be the private sector working with our government and our local leaders, we probably wouldn't have had that success. And so we've learned from COVID. FDA has learned, I hope FDA, and if I'm fortunate to be confirmed, I'll make sure they've learned that we can do things with a fast pace and still ensure safety. So I think the gist of what you're asking is something that I agree with, and that is that we should take the lessons that we got from COVID so we can do this faster and smarter and safer the next time.
Would it be a stretch then for you to say that you can give that credit to the Trump administration?
Certainly they worked on very hard, and it was a whole of government along with the private sector response, and there are a lot of people to thank. But without the work that the previous administration did, we would certainly not be here.
Good. Now let's get to the part we spent most of our discussion on, and that I, as the most vocal Senate Republican, have said since I've been here, the healthcare system is broken. Anything that costs twice as much as what it does elsewhere, delivering results that I know we have some things that are stellar, but generally not good. We had a robust discussion about whether you want to throw more government into a broken system. And here, I think there would be Republican support if you're embracing the thing most popular next to term limits, that means it's up there around 90%, healthcare transparency across the board. And before you answer, I notice that you're supported by the American Hospital Association, American Medical Association, 55 to 60% the cost of our broken healthcare system. Association of Health Insurance Plans. The only one missing is pharma, and I think I know why. Tell me that you would be there to push healthcare transparency to fix the system before you throw more government at it.
And Senator, here I want to thank you for the work that you've done on this issue, and quite honestly that Congress has done to try to move us forward. American people are entitled to know what they're buying, and especially if it's a life or death situation. And so what I can say to you is that we will do robust enforcement to make sure that price transparency is there for all Americans, because for far too long, people have never had an idea of what they're going to pay if they walk into a hospital.
Thank you.
Thank you.
Thank you, Senator Braun. Senator Murphy.
Thank you very much, Madam Chair. Let me concede Senator Burr's point that just because you sit on a committee of jurisdiction in Congress does not make any of us subject matter experts on the areas in which we hold hearings. But sitting before us is a healthcare expert. I worked with him very closely in the House on the development of the ACA. I've watched his work as Attorney General. This is someone who is in the weeds of healthcare policy, healthcare coverage, and I think we're very lucky to have him lined up to be the next secretary. I wanted to, frankly, build off of Senator Braun's comments because I think the healthcare industry delights when we spend all of our time here talking about who pays instead of how much we're paying. I mean, we sort of talk about healthcare in this country as if it is primarily a question of coverage. Whereas the real problem here is a problem of price. And you've done a lot of work in this area. I think a lot about the Sutter Health case, in which you went after a huge healthcare provider that had essentially cornered the market such to drive up the costs of deliveries in the Sacramento area so that nobody in the country was paying more than families were to deliver a baby there. From your experience working in this area of trying to assure competition, both in the provider space and the insurer space, so as to drive down prices, what do you envision the federal government is able to do to try to make the marketplace? And I think transparency is a piece of this, but some of this is also just anti-competitive practices amongst providers and insurers. What can the federal government do here to try to have a functional marketplace in which prices are going down rather than being set?
So, Senator, first, I appreciate the question, and it's great to see you again, and hope to have a chance to work with you all, as well in the future. I actually think Senator Ron hits on something very important. And transparency, if consumers knew what they were paying, they would really push to make sure prices go down. Not that just they know the price, but that the price goes down. That's why our effort was supported up and down the state of California when we went after the largest healthcare provider in Northern California, because people just had an instinctive feeling that the prices they were paying were way too high. And so what we have to do is be able to go behind the curtain. You have to be able to see how they're operating, how they're cutting some of these deals. And that is important. You all can help in Congress to give us the tools to enforce. And I would hope that I could work with you in the future to make that happen should I have the good fortune to be confirmed. I would also tell you this, that we want to always spur innovation, and we need the pharmaceutical industry in America to always feel like we've got their back to innovate. COVID is a perfect example of how we can come up with a vaccine, but we have to make sure we're getting our dollars worth. And I think there is where you all can give us more tools to make sure that we're getting our money's worth from all the different stakeholders in the industry.
I think transparency is a great place to start. I think there are limits to the gains you can get with respect to transparency alone, because the most expensive interventions people have with healthcare system are often at the moment when they are least able to shop around. And so I think the work that you've done to try to really go after these monopolies or these quasi-monopolies, that I think is really important. I look forward to working with you on that. My second question is around another issue that I know is very important to you, and that's mental health parity. We have a great bipartisan coalition on this issue because we've already got a law in the books that says insurers have to cover mental health just like they cover physical health. But we know that that's not really how it works out there. Anybody who's got a child with a mental health diagnosis can tell you they got to go through hoops and red tape and bureaucracy that nobody has to go through when they are trying to get cancer treatment or reimbursement for an orthopedic procedure. Tell us a little bit about your commitment to this issue, how you think that HHS can really push forward, because we don't necessarily have to spend a lot more money here. We can just make sure insurance companies are actually providing the benefit that they have promised to people, and we'll get a whole bunch more mental health coverage paid for.
Senator, you said it right, and I could take you back more than 30 years when I started working on this issue representing folks who had mental disabilities. We have, as you said, the laws in place. We just got to enforce them. We have to do the oversight, and there I would look forward to working with you to do that oversight to make sure that the stakeholders in our health system are enforcing, are applying the law correctly. We have to make sure that we don't let people fall through those cracks. We have to coordinate with the Department of Labor, because the Department of Labor has a lot to do with how these programs are implemented to get us to parity when it comes to mental health services. And so we can do a lot, and I know many of you are trying to work on this. I look forward to working with you on this because it is the hidden secret out there that everybody knows about the need to do more, but too often what's left in the crevice is reaching parity when it comes to mental health services.
Great. Thank you, Madam Chair.
Thank you very much. Senator Romney.
Thank you, Madam Chair. Bishop Becerra, good to see you again. Appreciated our meeting and very informative. Just a couple of comments based on the conversation that's been going on with Senator Murphy and Senator Braun. In the state of Massachusetts, where I served for a number of years, we did put in place an extensive transparency program. It gives very good data on the cost of various procedures in different hospitals, for instance, as well as their success rate in those procedures. But interestingly, the consumer has very little interest in that data because for them, the price is zero. In our system, individuals do not have an incentive to shop around for bypass surgery, for instance, even if they have time to prepare it, because it's free. Once you go past your deductible, and many people have gone through their deductible during a year, it's paid for 100% by their insurer or the federal government. And so it's free. So they don't care whether it costs $10,000 or $100,000 to have bypass surgery. So I'd suggest that it's important in your role to look at how we create a true marketplace, as Senator Murphy was indicating, which means that the consumer has interest in what something costs and therefore is anxious to shop around, particularly for elective surgeries and other high-cost treatments. Health savings accounts does that. In other countries, they have co-insurance as a way of increasing a marketplace. So just offer that as a thought. There's a division in our country with regards to the issue of abortion, of course, as you know, and mainstream Republicans or Democrats disagree. But most people agree that partial birth abortion is awful. You voted against a ban on partial birth abortion. Why?
So, Senator, here, I understand that people have different deeply held beliefs on this issue, and I respect that. I have worked, as I've mentioned, for decades trying to protect the health of men and women, young and old. And as Attorney General, my job has been to follow the law and make sure others are following the law. And I'm also sitting in front of a high-risk OBGYN who, for several decades, had the work of protecting the health of women and a future baby. And so I will tell you that when I come to these issues, I understand that we may not always agree on where to go, but I think we can find some common ground on these issues because everyone wants to make sure that if you have an opportunity, you're going to live a healthy life. And I will tell you that I hope to be able to work with you and others to reach that common ground on so many different issues.
I think we can reach common ground on many issues, but on partial birth abortion, it sounds like we're not going to reach common ground there. Let me turn to Medicare. You want to expand Medicare, as the President does. Our current Medicare program is on track to go bankrupt. The Trust Act is going to be completely insolvent. How are we going to expand something that's already on the track to go bankrupt? What's the answer? And this is obviously of great concern with regards not just to Medicare, but Medicare is the biggest one. It's the largest portion of our federal spending that's growing much faster than the economy, and which has the potential to sink our economic standing.
So I believe all of us will agree that our Medicare beneficiaries, seniors who paid into the system for so many years, should not be the ones who suffer when it comes to
totally agree. No one on either side of the aisle thinks that people who've retired or are near retirement ought to see any change in the program that would affect the quality of care they receive or the benefits. No question.
I appreciate you saying that. So really that means we're on track we have consensus that we have to find the solutions. And here's where I'll tell you that one of the things that President Biden has proposed is to allow Americans to essentially buy into what is considered Medicare at an earlier age. But rather than use the current Medicare system, which, as you mentioned, involves a trust fund, he would try to bring some revenue in from the general fund so that we're not impacting the trust fund. And so there are ways to do this.
Well, we do spend a lot of money from the general fund now.
We do. Yes, we do. But as we said, the priority should be to make sure Americans have good quality health care at their avail.
I think we pointed out that we've got a problem here, which is if it's already running a huge red ink program, expanding it is not going to make things easier. We're going to have to find some way to make this work, and I don't know that the administration has determined what that might be. My last brief question is this, which is that California has a lot going for it. The sun, the high-tech sector, great universities, but it's also known for high taxes and high regulation. Businesses have been leaving California, my state is a great beneficiary of that. Republicans say, watch out, if the Democrats get in charge, they'll make the whole country like California. Is that true? Is California working, or is California making a mess of things?
First, let me tell you, thank you for applauding many of the things that California does. But Californians recognize that we're one of 50 states. I will say this, we may be one of 50 states, but we're the fifth economic power in the world. And we create more jobs.
Well, you're big.
Yeah, we are. But there are a whole bunch of big countries that can't do what California does. And what we've been successful is in graduating more people from college than anyone else, having the #1 industry in high tech. At the same time, we're #1 in ag. We're #1 in manufacturing, if you believe that, just as we're #1 in entertainment and tourism. We have been able to bring innovators to the state. But you're right. We have to face a lot of challenges as well. And I think California recognize that we are fortunate to be part of this great country we call America. And so I thank you for giving me a chance to boast about my state.
Thank you, Senator Romney. We will turn to Senator King.
Thank you, Madam Chair, and thank you, Attorney General Becerra. Congratulations on your nomination. There's been some discussion around the table this morning about your experience, and I just was reflecting, as Lieutenant Governor, Governor, Senator, I've worked with 6 HHS secretaries. 5 have been attorneys or business people, and they've had multi-year tenures. 1 was a physician, and his tenure was measured in a matter of a few months. That's not to say that a physician couldn't be a great HHS secretary, but we've had plenty of good business folks and lawyers who've been strong HHS secretaries of both parties. Here's what I like about your experience, not only your time in Congress working on the pivotal laws that will inform much of the work that you do, but I like that you are coming from a state government. I was, frankly, at the beginning of the Biden administration, a little nervous when I saw the COVID panel put together. Didn't have a lot of people with state-level implementation expertise. The fact that you are coming as the Attorney General of California with state-level experience, that you have a nominee to be your Assistant Secretary for Health, Dr. Rachel Levine, who is the Chief Health Official for the Commonwealth of Pennsylvania and the President of the National Association of State and Territorial Health Officials. I think that would put in the top 2 health spots in HHS a strong state focus. We can do all kinds of great things here. If they're not able to be implemented at the state level, you know, what good are they? And so I appreciate that aspect of your experience. Let me move to my questions. So many things I want to ask you about. I'm very, very concerned about the mental health needs of our healthcare workers, what they've experienced before COVID, but certainly since March. Death at an unprecedented scale, having to manage end-of-life discussions with patients, holding iPads in front of their faces so they could talk to their family because their family can't come into the hospital. This is going to have a significant consequence in our healthcare profession for a very long time. We also have healthcare workers who still today are worried about seeking mental health counseling because of stigma, because of concern about licensing or credentialing, or that they could, through some regulatory move at the state level, face career-ending or jeopardizing consequences. You're married to a physician. Tell me of the ways you would prioritize the mental health of our doctors, nurses, and healthcare professionals should you be confirmed as HHS Secretary.
Senator, by the way, first, thank you for the work you've done on this issue for so long. And you're right. At the state level, when you're in government at the state level, the rubber hits the road. What you all do in Congress, what I used to do when I was a member of the House, is come up with the ideas, and we pass it into law, but it's the state elected leadership that has to make it work. And I have done everything I can to make sure that California, through the leadership of our governor and our state leaders, is putting into effect the safety protocols and all the regimens necessary to make sure that we move forward. On the mental health of our workers, public health workers especially, 1, we have to make sure we provide them with the resources. 2, they should know that they are essential and they will be priority 1 when it comes to vaccines. 3, we have to make sure that they are rewarded. They should not have to worry about whether they have enough money coming home to feed the family. We also have to make sure that we don't give stigma to getting mental health services. I face this a lot in law enforcement with peace officers who were afraid oftentimes to get mental health services because they're afraid that that'll go on their record and will deprive them of opportunities to continue forward. We have to make providing mental health services something that's part of life. Just like you get an annual checkup, mental health should be part of that as well. And that goes back to a previous conversation about making sure that we treat mental health the same way we treat physical health. We need to provide the resources to provide parity to mental health. Then we'll prove to people that we're serious about addressing mental health concerns.
Thank you, Mr. Attorney General. Today, Senator Bennett and I are reintroducing a bill we have called Medicare X, which is a vigorous public option bill that's similar to what President Biden campaigned on. I'm not going to ask about that because we're just introducing it, but I hope to have the opportunity to work with you. One last question, and this is back to the state, kind of a state issue. Coordinating with governors and state officials. The acting HHS secretary recently indicated that it's likely that the public health emergency related to COVID might be extended throughout 2021. Talk a little bit about how you would work with governors and others as the administration is making that decision so that they can have ample planning time for the ending of the emergency period.
Certainly, Senator. First, science and data have to drive our decisions. If there's going to be a declaration of an emergency, health emergency, or a continuation of it, it has to be based on real data, something that gives us that information. Secondly, we have to be in partnership with the folks who have to implement. As I said before, we can say what we got to do, but it's the folks who have to do it who have to make it work. And so we have to do that in partnership. That means bringing the information to them early so they're part of those data-driven solutions. And if
And I want to be respectful of my colleagues, but thank you very much. And Madam Chair, yield back.
Thank you.
Thank you so much, Senator King. I understand that Senator Marshall has not returned, correct?
That's correct, Chairman.
Okay, so I will turn it to Senator Hassan.
Well, thank you, Madam Chair and Ranking Member Burr. Welcome, Attorney General Becerra. Thank you for being here today, for your interest in service, and thank you to your family, too, because this is a family commitment, so we deeply appreciate your service. I want to start with talking to you about the opioid epidemic. As you know, it has devastated communities all across my state. Since 2017, I've worked with colleagues to secure billions of dollars in state opioid response grants, including more than $86 billion for New Hampshire. This funding has enabled states to expand access to life-saving treatment and services for those struggling with substance misuse. And we're finally beginning to see results with death rates decreasing. But I am deeply concerned that hard-won progress is in jeopardy because the hardest-hit states, including New Hampshire, are at serious risk of a dramatic cut in state opioid response grant levels under the program's current funding formula. So, Mr. Becerra, if confirmed, will you commit to working with me and the Substance Abuse and Mental Health Services Administration, SAMHSA, to ensure that states do not experience a dramatic cut in state opioid response grant funding, a cut that could jeopardize our efforts to turn the tide on the opioid epidemic?
Senator, absolutely, you have that commitment.
Well, thank you. I want to turn now to another issue connected to substance misuse. As you know, one major hurdle that keeps people who have substance use disorder from accessing the support and treatment that they need is the existence of the so-called X waiver, the requirement that doctors who want to prescribe medication-assisted treatment receive a waiver, or essentially permission, in order to prescribe buprenorphine. This waiver limits the number of medical professionals who are able to prescribe this treatment, even though it's considered the gold standard in medication-assisted treatment. The waiver requirement does not improve patient safety, but it does limit access to care. About 40% of counties across the United States lack a waivered practitioner who is able to provide this treatment. Senator Murkowski and I plan to reintroduce our bipartisan MAT Act, which would eliminate the burdensome waiver requirement. We also sent a letter to President Biden inviting him to work with our bipartisan group of senators and representatives on this issue, and we're encouraged that he has expressed support for this change. Do you agree with President Biden about the need to eliminate this waiver, and will you commit to working with our bipartisan group on this much-needed reform?
First, thank you for the work that you and Senator Murkowski have done on this issue. As you said, President Biden is supportive of moving forward. We have a pause, as you know, on a number of these rules that are in place, but I think there's a commitment on the part of this administration to make sure we're providing that treatment that is indispensable for so many families.
Yeah, it is one of the sad and disturbing ironies of this crisis that doctors don't need special permission to prescribe opioids, but they do need special permission to prescribe the medication that would help people combat the disorder and get better.
And if I could just add, Senator, I think here the president's goal is to get it right.
Right.
We don't want to end up in court and delay it even further.
Right. I understand that. Let me turn to another issue. As you know, Senator Cassidy and I spent several years working with former Help Committee Chairman Alexander and current Chair Murray on bipartisan legislation to end the practice of surprise medical billing. It was a great example of the type of bipartisan work that can be accomplished in the Congress when we work together to find common sense solutions. Now that the surprise medical billing legislation has been signed into law, the responsibility to implement these protections will fall to the Department of Health and Human Services. So if confirmed, you're going to be responsible for implementing these policies quickly and in a manner that protects consumers and reflects congressional intent. If confirmed, will you commit to working with us on a bipartisan basis to ensure that 1 year from now, the rules issued by HHS include strong protections for consumers that reflect the priorities and intent of our legislation?
Senator, we got till 2020, the beginning of 2022 to get this done. I know this one's important to you and so many. Thank you for the work you did to succeed. I hope we are truly a partner with you on this, and I know that we got to get this arbitration provision right along with the consumer protection.
Well, thank you for that. I appreciate that commitment and look forward to working with you. Just one last thing. We're all grateful to the scientists and public health experts who worked so quickly to develop the Moderna and Pfizer vaccines. I believe in their effectiveness, but we also know that we are seeing the emergence of new COVID-19 variants and that we're going to need to continue research and surveillance efforts so that we can continue to develop effective treatments and vaccines. So what steps do you believe we have to take to be prepared to respond to the emergence of these new variants and protect our vulnerable populations?
Senator, sequencing is so critical. We have to have the scientists tell us what the next iteration of that virus may look like. We have to stay ahead of the game because we're now with this vaccine getting a grip on COVID. But if a variant takes off, we don't want to go back to square one. And so we need to be doing the sequencing. We need to provide the scientists with what they need. We have to also rely on data. But we have a tremendous job to do to make sure we stay ahead of the variants.
Thank you very much. Thank you, Madam Chair.
Well, Senator Heston, thank you so much. I believe we have Senator Rosen available. Senator Burr, did you want to go next or?
Senator Rosen's fine. Senator Murray.
Okay. Senator, as I am going to go over and vote and return. So on our side, I believe we have Senator Rosen and Senator Smith. I will let them go. Do you want to go in between them or after them?
No, we'll keep the order. If another Republican comes in the meantime, we'll slot them in, but I'll go vote as well as you.
Okay, if we can do that, then we'll go to Senator Rosen, Senator Smith. If a Republican comes in, we'll put him or her between you, and Senator Burr and I will return.
Perfect. Thank you, Madam Chair and Ranking Member. Here we are, and thank you, Mr. Becerra, for, of course, being here with us today. Thank you for your commitment to serving our nation. I really appreciated the great and productive conversation that we had in the meeting last week. I look forward to learning more about your plans to combat the pandemic, to quickly distribute the vaccines, address our nation's provider shortage, which we know is really important, and increase our access to quality, affordable health care. And I do urge this committee to facilitate a swift confirmation for Mr. Becerra so he can get immediately to work for the American people. So vaccines, it's on everybody's mind, right? The pandemic, of course, is hitting Nevada particularly hard, especially with so much of our economy relying on the travel and tourism industry. The best way to revive Nevada's economy, save lives, is to increase the number of vaccines. We have to continue to build on the good work that President Biden has already done and work together to make sure that no one is left behind and that the response is equitable. So, Mr. Becerra, we've seen more vaccines coming into our states over the last few weeks, but it's really critical that the allocation formula is updated with the most recent population data, so rapidly growing states like Nevada get their fair share. Will you commit to being sure that all the data is as up to date as possible as we begin to continue to distribute vaccines across the country?
Senator, thank you for the question. By the way, and for just the yeoman's work that you and others have done in the state of Nevada, which is probably one of the hardest hit states. Absolutely, I commit. We will work with you to make sure that the data is accurate. We want to make sure, as I've said before, that we are sending the product, the vaccines, all that is needed, where it is needed most. And so we will definitely look forward to working with you to make sure Nevada gets its fair share.
Thank you. Another issue, of course, we always have this problem in Nevada and many places across the country, but the pandemic has really shined a spotlight on that. It's our provider shortage issue in every county in Nevada has a shortage of healthcare providers. The pandemic has accelerated the urgency for us to address these issues and all the challenges that surround it. Our state ranks last in per capita number of general surgeons, 48th for primary care, and 45th for physicians overall. Some Nevadans in our rural areas travel about 300 miles just to find a specialist to provide the care they need. You know, we're working hard to increase our number of doctors. University of Nevada, Las Vegas School of Medicine, they're graduating their inaugural class this year, so that's great for our state. But we have to do more. We have to increase our graduate medical education slots. These are critical to addressing our provider shortages. The slots were included in the last recovery packages, but of course we have to do more. So will you commit to working with us to ensure that Nevada institutions and other states with similar issues as ours receive their fair share of the new graduate medical education slots? And what else do you think you can do to help us increase our provider shortages across the medical spectrum, doctors, nurses, and the like?
Senator,
mental health professionals, let's talk about those, right?
Thank you for the question. First, I have to say thank you to you and your colleagues for including the 1,000 slots, the GME slots for graduate medical education, so that we could actually see those future doctors in places like Nevada and throughout the country. And so thank you for that. As you know, President Biden has made the commitment. He wants to put 100,000 new public health workers out there to help states like Nevada make sure that you're reaching all your communities and protecting them with vaccines and all the different types of things we have to do to protect them from COVID. And we just have to be there, generally speaking, long term. My wife has mentioned to me how it looks like there's an increasing number of Americans who are applying to medical school. Maybe it's because they've seen just the yeoman effort performed by so many medical professionals, and they see that as a truly worthy profession to be in. Whatever it is, we should take it, and we should reward those who go into the health profession. And so I look forward to working with you and your colleagues to make sure that becomes a reality so we can service the needs of all our people.
Thank you very much. And just in the quick time I have left, I just want to know what you think we should do in communities of color. Some of our minority communities, COVID has hit them the very hardest. How do we ensure greater protections for them? What are you planning to do in that regard?
Senator, thank you for the question. I'll look forward to working with you on this. Let's just use data to drive decisions so that they're done transparently. Let's make sure that we make every effort to reach everyone. Some communities, whether rural or inner city urban, will need mobile clinics so that we can make sure they get the COVID vaccination. We can do things, but we have to work with those communities, use their civic and religious leaders that they respect to help us reach populations that too often have gone absent.
Thank you so much. I think my time's expired. I look forward to working with you in this administration. Thank you.
Thank you.
And Attorney General Becerra, this is Senator Smith calling in. I think since everybody is now in the midst of voting, I'll just jump in here and have a chance to ask my questions. It's great to see you again. I want to congratulate you on your nomination. I so enjoyed the chance to talk with you a couple of weeks ago, I guess it now was, and I could hear in your comments your commitment to public service and your deep belief in the power that we have to do good for people in this role, which I really appreciate. We are nearly a year into this public health and economic crisis caused by COVID, and we're not going to get out of this economic crisis before dealing with the public health crisis. And we know that this is going to require significant leadership and a national strategy. And this has been what many of my colleagues have been talking about today as we ask you questions about this. I want to just say at the outset that you clearly have the experience and the record of accomplishment to lead the Department of Human Services. This is a large and complicated, massive agency with significant responsibilities. I just want to point out and remind everybody that as California Attorney General, you run one of the largest state departments of justice in the country, and that you've also spent over 30 years of your career in public service fighting to help patients and families get the care that they need. Your record standing up to price gouging by large hospital chains, taking on the big opioid manufacturers, defending the health care for millions of Americans is a record of accomplishment that I think qualifies you so well for this position. So thank you.
Thank you very much for that. And I look forward, if I'm fortunate to be confirmed, to work with you on some of these issues. And I hope you'll invite me to your great state. I have so many good friends, including your Attorney General, who I would love to see, and there are many things to do.
Well, yes, that's right. And you and Attorney General Ellison have joined forces on many issues, and especially and including holding these big pharmaceutical companies accountable for price gouging. So I'm grateful for your work. I want to take my time that I have left talking to you a little bit about another area of great importance to me and to so many families and businesses in my state, which is the issue of childcare. So even before the pandemic, families were really struggling to find affordable, high-quality childcare. This is an issue across the country and across my state, both in rural areas as well as in metropolitan areas. You know, I have spoken to parents in Minnesota who are confronted with driving 50 miles to take their children to the childcare center, to the childcare provider that they can find. And this challenge has become even worse with COVID because so many childcare providers have literally gone out of business or had to close their doors because of the challenges that they faced. And so this is why I have worked so closely and hard with Senator Murray and also Senator Warren to call on Congress to provide $50 billion of relief to stabilize the child care system, because child care is essentially infrastructure for our economy and for our families. And I know that you have a real interest in this and that you understand the importance of elevating human services as part of health and human services in your role. So could you please talk to us a little bit about your priorities when it comes to child care, high quality, affordable child care, how you see this challenge, and what you'd like to see us do to make sure that child care is available for families so that we can keep women in the workforce and we can make sure that our kids are getting the very best start.
Senator, thank you for the question. And you were breaking up a bit, but I do believe you were asking how we would meet this challenge of providing child care to American families. And what I can tell you is, first, I hope that you have great success with your colleagues in trying to move your legislation forward. We need to stabilize this field because child care providers have been some of the hardest hit in America because of COVID. And the services they provide, especially when they're done well and safely, are indispensable to the rest of America that needs to get back to work. And so I hope to work with you, if I'm fortunate to be confirmed, to try to move on this, because I think now America, maybe 30, 40 years ago we hadn't settled on this, but now America realizes how important our child care workers are to our livelihood, to our economy. And I hope that you have success as you move forward, and I look forward to using the tools at HHS, if I'm fortunate to be confirmed, to help you get there.
Well, thank you. I look forward to working with you on that. This is a crucially important issue, and so thank you very much. Chair Murray, I'll give back my time.
Okay, great. Thank you so much, Senator Smith, and we will turn to Senator Tuberville.
Thank you, Chairwoman. Good morning.
Senator, good to see you again.
About had it.
Thank you.
Couple questions real quick. I'm concerned about President Biden's freeze, as we talked about some of his regulations that President Trump had put in. as HH Secretary, how are we going to get the price of insulin down? We've got to get it down. People can't afford it.
So very quickly on the issue of the freeze, I think pretty much every administration, when they come in, they want to take a look at the landscape and see where things are. So as they come in, they can move forward. And so there is a pause in many of the rules that were being proposed and move forward. But I guarantee you, as quickly as the president and his team can, we will get back to moving forward on some of these administrative actions. And in terms of insulin, first, Senator, thank you for the. Actually, I thought it was a great conversation. I hope I didn't take up too much of your time. You were gracious with your time. On insulin, look, patients have to come first. We have to make sure that they're not going to get caught in this mess about how much it costs. But there's no reason why the price of insulin should jump by essentially 100% overnight. And we have to deal with that. We want to make sure the drug manufacturers are properly compensated. But at the same time, these are life-saving medications that people need, and we have to make them available. So I look forward to working with you and your colleagues to make sure we can do that.
One other thing I'm concerned about with drugs, I talked to rural pharmacies, especially in the state of Alabama. They're like hospitals. They're like doctors' offices because they're the only connection they have to healthcare in some of these areas. We're losing some of them because of PBMs. They're getting priced out. I saw the good work you've done with several attorney generals across the country. It's explain your plan with PBMs and cutting out a little bit of that middleman where our pharmacies can make some money.
Yeah, the pharmaceutical benefit managers have a role, right? But as we discussed,
I hadn't figured it out yet, but
well, and the role can't be to just be middlemen and to gouge the price and to take too big a cut. But they do play an indispensable part in the way we run through the process of dispensing medications. And so what we have to do is keep them on their toes. And as you mentioned, on a bipartisan basis, a number of us as state AGs took on the PBMs because at the end of the day, they're supposed to serve the purpose of getting a good price from Medicare for the drugs that our seniors need. And so we didn't, come up with a solution just as state AGs. Much of this has to be done at the federal level, and I look forward to working with you on that because they serve a purpose, but it's got to be the purpose of getting good price medication to our seniors.
Yeah, it seems like they're working more for the bigger pharmacies and the hospitals, and the smaller pharmacies are paying these rebates, and they're paying all their profits. And we just can't lose them in these rural areas across the country. If we do, we're going to be in serious trouble because we're losing. In Alabama, for instance, we've lost 14 hospitals in 10 years, in rural hospitals, and the only thing they have left is a pharmacy. And so, when you're confirmed, I'd love for you to, pay close attention to them. Make sure these people make a little money. Make a little money so they can stay open.
I'm looking forward to working with you if I'm fortunate to get confirmed because, as you said, the little guy who's, especially since they service some of the small communities, should not be the ones that lose because the big guys are trampling all over them. So I look forward to working with you.
Thank you. Thank you very much. Thank you, Mr. Chairman.
Thanks, Senator.
Thank you, Senator Marshall. I believe that Senator Marshall or Senator Moran is not back. Is that correct? I believe that is true. Sorry, Attorney General Becerra, we had votes and members are coming and going. I know that Senator Burr is going to return in a minute. Is Senator Marshall available?
Yes.
Great. I will turn it to Senator Marshall.
Okay, Madam Chair, thank you so much, and welcome to the hearing here, Mr. Becerra. We're glad to have you. I want to first, if I could, just submit for the record the vaccine distribution plans from every state in the union. I think that we had most of these back in October. Maybe there was some confusion about those, and we've got all 50 of them here, and if that's okay with you, Madam Chair.
Yes.
Let's talk first of all about maybe pharmacy prices. Over the past 3 to 4 years, pharmacy prices have pretty well stabilized in this country, between no growth in price to maybe 2%. And my question is, what stabilized the price, and what role do you feel that pharmacy benefit managers have to do with the price of pharmacies at the counter?
So, Senator, thank you very much for the chance to answer the question. And Senator Tuberville just touched on that issue. Okay. As I mentioned, PBMs play a role. They have an important role to make sure that we get these prescription medications to the source, to the consumer, the senior on Medicare. And so we have to make sure that everyone's doing their part. And right now, we see that there's a growing fight developing between the manufacturers of these medications and PBMs and the providers. And what we have to do is make sure that at the end of the day, our seniors aren't the ones that pay the price. They're the ones that need the drugs. We have to make sure they get them at a good cost. And I can't tell you, I can give you the solution in the time that you have in the 5 minutes, but I certainly am willing to work with you because that is before us right now.
How many pharmacy benefit managers are there, and how much of the market do they control?
Oh, that's a great question. I can try to get back to you on that one.
Yeah, well, I think there's 4 of them, and they control over 80% of the market. You know, one of my concerns is I look over at HHS in the office here. I've been there once or 3 times, and I look around. There's lots of lawyers, lots of bureaucrats, but how many nurses and pharmacists and doctors and those type of people are actually working here in Washington, D.C. at HHS? What percentage of your staff of, what is it, 80,000 people?
Well, first, you're gracious to call them my staff. I have not yet been confirmed. I hope that's a signal that maybe I will be confirmed. A great number of them are healthcare professionals, certainly the people that are at the top levels of some of our important agencies, CDC, NIH, FDA, have healthcare and medical backgrounds. And we're going to make sure that the team, and I know this from speaking to the president, that the team in place at HHS will have the expertise that we need to do all the work, because HHS isn't just about delivering on services on healthcare. It's about being good stewards of the purse, because as someone said earlier, HHS has the largest budget of any federal agency, including Department of Defense.
All right, let's talk about value-based health care for a second. Some of the legislation that we've worked on is a legislation called the Regulatory Sprint to Coordinated Care. And what that had to do was with stark anti-kickback for doctors that are participating in value-based care. And another one of our signature legislations we worked on is prior authorization issues. A practicing doctor myself, it's pretty cumbersome to have a person who's never practiced medicine tell me I can't do a surgery that I think is necessary. So, you know, just in general, how do you feel about value-based health care and what its impact could be on, frankly, the cost and the quality of health care?
First, if I could just comment and say, this is where the practical work that you have done informs the work that Congress must do, because you can talk about these things not just from your own thoughts, but because of your practice. And what I will tell you is that when it comes to making sure that we are administering these programs, we have to make, forgive me, can you pose the question again? Because I was going to go off on a different tangent.
Yeah, what do you think of value-based health care, and in particular, allowing physicians to participate in value health care arrangements?
If we have time, I'll go to the point I was going to make, but I know time is expiring. We've been moving. I remember during the entire Affordable Care Act debate, it was all about making sure we're talking about value versus volume. Instead of having people just coming through your door in your mill and not really tracking them, it's, are we extracting value out of the service that you as a doctor, the hospital provided, so that we follow that patient all the way through? So if we truly do this the right way, we will reduce the number of visits, we'll reduce the number of incidents, and we'll provide quality care instead of quantity of care.
Great. When I talk about value-based health care, I think about patient outcomes. I think about the patient experience divided by the cost of that. And I look forward to a second round of questions. That went by pretty fast.
Yes, it did.
Thank you.
Thanks, Senator.
Thank you very much. We will go to Senator Moran.
Chairman Murray, thank you very much. Attorney General, nice to see you. Thank you. I'll try to get through, I think, 3 topics as quickly as I can. Let me start with 340B drug pricing. Mr. Attorney General, you led a multi-state letter to HHS to address the discounts and the drug manufacturers' discounts to covered entities in the program. Our Kansas Attorney General joined you in that letter. But I continue to hear 340B has been a significant issue for as long as I've been in the Senate, maybe as long as I've been in the Congress. But we continue to hear of dire circumstances with our healthcare providers, our hospitals, particularly our community health centers. The Community Health Center of Northeast Kansas expecting to lose $300,000 in revenue this year alone due to the 340B issue they're facing. Labette Health has lost almost $700,000 in revenue. If confirmed as the Secretary, how do you intend to protect the integrity of the 340B program and to make sure that it works for the provider, but as well for their patients?
Senator, thank you for the question. And here I will tell you that the previous administration issued some guidance. They issued an advisory opinion, and we'll try to build on the work that's been done in the past. But what we must do is we cannot sacrifice patients. They should not be the ones that suffer as a consequence of the fight that's going on here. I will guarantee to you that if I am fortunate to be confirmed, I look forward to sitting down and working with you and others who are interested in addressing this issue, because 340B has become an indispensable program for some of these providers who are really helping some of our neediest populations.
As you may know, the rural hospitals are on the cusp. COVID has not been helpful, but they're always hanging on by a thread.
That's right.
And the 340B program is perhaps one of the most important. If it disappears in providing resources to hospitals and their patients, we're going to lose another series of hospitals in Kansas and I assume California and across the country.
Agree.
Let me ask you, Attorney General, I want to talk about the nation's healthcare infrastructure in the world of transplants. This country has the world's leading transplant surgeons and hospitals, but thousands of people die every year because of the scarcity of donated organs. Currently, there are 100,000 Americans waiting on a kidney transplant. Do you agree that HHS should be working to increase the number of kidney transplants nationwide?
We have to do much more because you're right. There are too many people who are going with unmet need and dying.
If you're the Secretary at HHS, will you act against policies that are expected to reduce the number of kidney transplants nationwide?
I certainly will try to work with you on some of these issues. It'd be difficult to make a commitment right now before I have a chance to step into the shoes.
Well, let me tell you that Secretary Alex Azar told us that he was powerless to prevent changes in policies from taking effect. I hope at HHS, as a secretary, you would have the capabilities of dealing with the agencies within your department who deal with this issue. Would that be your desire?
Well, those sub-agencies better know that that will be my desire.
HHS contractor responsible for organ transplants, the United Network for Organ Sharing, is currently under a bipartisan investigation by our Finance Committee, but is still set to implement a policy in mid-March that affects kidney transplants. So I've set the stage for you in asking my questions. This policy was opposed by a large majority of transplant professionals, and the government's data predicts it will result in fewer transplants and more patients dying. I need your commitment that you will work with me and others in similar circumstances to see that the transplant program is improved, not harmed, and that transplants that organs that are donated in a region are able to stay within that proximity to be donated to those who need them within that region.
Senator, you have my commitment to work with you on that.
Thank you very much. And let me finally highlight the importance of telehealth. We've seen this for as long as I've been in Congress. We've been working to increase broadband services across the country. We've seen in the COVID-19 response the inability to do so in the area of education and health care. And there are a number of provisions that were provided in the CARES Act and other legislation that waive certain requirements for telehealth, including reimbursement at rates as if you were in the office of the provider as compared to on telehealth.
Yes.
Those, I hope, will garner your support. And I think what we've learned is they're not just necessary during COVID. They are necessary into the future after the days of COVID are behind us. And again, I would ask you if you agree with that sentiment, and we'll work to see that the provisions that we've made to enhance the availability of telehealth continue.
Senator, wholeheartedly believe that we're going to be doing expansion of telehealth. COVID has taught us so much. It's also the issue of broadband, making sure communities have access to broadband. But if we don't learn from COVID how telehealth can help save lives, then we're in trouble. And so I think we're going to advance, and I look forward to working with you on it.
Attorney General, thank you for your answers.
Thank you.
Thank you very much. Senator Burr has not yet returned. We're waiting for Senator Hickenlooper. I'm going to go ahead with my second round of questions, and hopefully Senator Burr will return. And I believe Senator Marshall wanted a second round, and he'll be able to do that. So Attorney General Becerra, this pandemic has really caused significantly more hardship for communities of color worsening underlying health inequities resulting from a long history of structural racism, discrimination, and bias. And I am deeply frustrated by how the Trump administration ignored those inequities in its pandemic response, and in many cases made them worse. I issued a report on the impact of the pandemic on communities of color last year that included several recommendations about the need to address health inequities in this country, and we've got to make progress in addressing those recommendations. We need to offer support to Black, Latino, tribal communities, and other communities of color to make sure that those who are suffering the most from this pandemic are at the forefront of our response. We need to address discrimination within our healthcare system by investing in healthcare providers who serve those communities and combating implicit bias in healthcare delivery. And we have to work to make sure that all people, including families of color and people who are paid low incomes, have access to high quality, affordable care. And we need to make some new financial investment in the health communities of color. We got to do better, not just on COVID, but on a lot of our healthcare issues that are particularly harmful for communities of color, issues you know well, maternal mortality, ensuring that people of color, pregnant and lactating women, people with disabilities, and other underserved populations are included in research and clinical trials. Our work to combat health inequities must be woven into the fabric of everything we do to advance public health and create a fairer healthcare system. Attorney General Becerra, you've expressed that healthcare equity will be a priority for you. And I actually have been very heartened to see the president appoint leading experts to his COVID-19 Health Equity Task Force. Can you comment on how you will incorporate health equity across your work as secretary?
Senator, you said it so well, and what I can add is that we will have a team at HHS that lives and breathes the desire to have health equity. We will have people who have experience in that field, and we will move to make sure that we have the resources put in place. Something as simple as making sure, as I think I mentioned before, that our surveys are, when NIH is doing a study or CDC is doing work, that we are including these populations that have often been left behind, so that when we get results that are good for everyone, especially those communities that have been left out in the past. We have to make sure we reach out to these communities because they're just starving to hear from us. They want to know that they count. And if we turn to their respective leaders, religious, civic leaders that are in their communities, we'll be able to have that access to them to be able to approach them and get things done the right way. But it does start here in making sure that our policies reflect our words, and it sure does help, as you said, to have the leader of this country, the President of the United States, say he's committed to it, and demonstrated by one of the first things he did is impaneling this COVID task force on equity.
Great. I look forward to working with you on that. And I do want to take a moment to highlight HHS's role in childcare and early childhood education. We know that even before this pandemic, our nation was facing a childcare crisis. Parents across the country were paying more than they could afford for childcare, and they were really struggling to find available childcare in their communities. And early childhood educators were earning poverty-level wages despite doing critical work each day to support our children, our families, and our economy. Now the coronavirus pandemic has further destabilized our childcare sector, and childcare providers are now at risk of permanent closure, while parents are, of course, continuing to struggle to meet their childcare needs. This is unfortunately still a responsibility that disproportionately falls on women, and it is one of the reasons we're seeing so many women leave the workforce today. So we need a strong childcare system to advance our nation's economic recovery so parents can get the childcare they need to return to work. Attorney General Becerra, you have advocated during the pandemic for additional investments in the childcare sector. You've been a supporter of early childhood education since your time in Congress. So I wanted to just ask you to comment on that, on what action you see that we will need to take for affordable childcare for our working families.
Senator, I think the COVID pandemic has made clear to so many Americans how indispensable childcare workers are and how they are worth their weight in gold. And I hope that what we see as a result of COVID is a true recognition of the value of childcare workers, of our teachers, and reward them properly so that we can make sure that we have the professionals we need taking care of the future leaders, perhaps the future president, future senator of America, and it is in their hands that we put our most precious possessions and the future of our country.
Well, thank you very much. And I know that Senator Burr has returned. We're waiting for Senator Hickenlooper to jump online. Is Senator Hickenlooper available yet? If not, Senator Hickenlooper, you're on if you're ready.
Yes, I am, and appreciate your. We're trying to get the vote in, so apologize for being a little bit late to the party. So I wanted to first off congratulate our nominee for Secretary of Health and Human Services. I think you're going to bring deep experience and clearly your passion for public service to the department. Healthcare and small businesses they go hand in hand. And I think small businesses are the heart of our community, but they often face a razor-thin margin, a challenge made dramatically worse by this pandemic. And even before the pandemic in 2019, a Commonwealth poll found that 74% of small business owners had considered the cost of providing health insurance to their employees as either a major or a minor problem. So how would you suggest and think about or how would you plan to support small businesses and their employees and help them make sure they can access the health insurance that they need at an affordable cost?
Senator, first, thank you very much for given me a chance to sit down with you. I appreciated the conversation we had. President Biden made it very clear in his rescue package. We need to do more. Some of the support, the resources will be focused on our small businesses. We have to make sure that we don't forget those. One of the things that we can do at the federal level, because we contract out so much of the work that we do, is to make sure that our agencies are looking to hire small businesses to do the work, the contracting work that we must have done. And so we should have an emphasis, and I hope to be able to work with our Small Business Administration administrator to make sure that so much of the work that will emanate from HHS does go to our small businesses throughout the country.
Right. Well, and we agree with that. And I think, well, as you know, many of the providers, primary care physicians, dentists, eye doctors, nurse practitioners, are often small businesses serving the healthcare needs of towns across the country. And yet the American Association of American Medical Colleges projects that by 2033, we could have a physician's shortage of upwards of 100,000. The main shortage will be in primary care. The hardest hit will be obviously rural and underserved urban communities. What can we do to provide more support and increase the number of primary care practices, especially in those rural and underserved areas?
And I speak as someone who at the kitchen table hears this constantly from my better half about what we can do to really get the medical community to be more robust. And one of those things is, especially primary care physicians, is give them a chance to know that they'll be rewarded for everything they do. Too often times, those future doctors go into the specialty care field. There is more remuneration in those fields. But primary care, everyone has to go through their primary care doctor before they can see a specialist. And so it's important that we reward the work that's being done by those primary care physicians. You all made a major investment in getting more doctors out there in the future when you put in 1,000 slots in the GME program to bring out more future physicians. And I will tell you that it's become clear how indispensable our healthcare workers, especially our medical professionals, are. And I hope that what we find is that our medical schools, our nursing schools, all our healthcare teaching institutions see a rise in the number of people who are applying to become the next generation of healthcare givers who save lives.
Right. Well, we agree with that. And my next question, and again, I should have started off and thanked you for spending some time with me before this hearing. But we talked a little bit about climate change, and I appreciated very much your perspective. And we agree that climate change does really pose a major threat to public health. We've directly seen the the devastating effects of flooding and wildfires in Colorado, and really growing natural disasters are harming communities across the country. Look at Texas and much of the South this last week. Increasingly, frequent natural disasters they're harming air quality, water quality, and really public safety in communities around the country. As HHS Secretary, how would you respond to the growing health impacts of climate change, and how would you go about addressing the fact that these public health impacts disproportionately harm communities of color and other vulnerable communities?
I could spend far more time than we have, Senator, to talk about some of those things, but let me just mention a couple. Just last year, places like San Francisco, Sacramento, very urbanized areas, lost sight of the sun when we saw these wildfires raging outside of our areas, but the smoke reaching our densely populated urban areas. We have to do something much more. And we have to do it for those communities that are hit first and worst. That's why at the California Department of Justice, I established the Environmental Justice Bureau, because too often decisions that are made today won't be seen until later having an effect on our communities. And those that are hit first and worst will be those disadvantaged communities. And so our Environmental Justice Bureau works with our local leaders to make sure that as we think about development, we think about the future and what the impact will be. But there is no doubt, in the breadbasket of the world, the Central Valley of California, 1 in every 4 children has asthma. That should not be. And we have to tackle this now, because if we don't, it won't just be 1 in 4 children who has asthma. It'll be far worse. And so I look forward to working with you and your colleagues to make sure we can truly address the health effects of climate change.
Thank you very much, and I look forward to working with you as well.
Thank you, both of you. And Senator Marshall, I understand you had an additional question.
Yeah, thank you again, Chairwoman. Maybe just a couple quick ones. RU-486 is a drug I've never prescribed, but unfortunately I've had to take care of people with complications from it. Cramping, bleeding, hemorrhaging in the emergency room. And I've been told is that you've supported removing current safety regulations, and just wanted to know your position on that. And not only am I concerned about the physical care of that patient, but anyone that's taken this pill for an abortion obviously needs emotional support. And I just hate to see those drugs, let alone, and birth control pills for that matter, handed out like candy. These drugs do have serious complications. I do want women to have access to family planning, but the RU-486 drug very much concerns me.
Senator, thank you for the question. Mifepristone, which you labeled RU-486, when I took action along with many of my state AG colleagues, it was to try to make sure that all Americans had access to the care they needed without having to worry about COVID becoming a danger. And the fact that we are able to dispense care without having to have our families actually show up at the doctor's office now through telehealth and other means is something that we should really build on. And any obstacles to getting safe care should be removed. And our letter that we directed on RU-486 was to make sure that women who wanted to take advantage of health services that they had within their reach didn't have to do so by risking the contraction of COVID in order to get that health care. And that was the purpose of that letter, is to make sure that, like any American, we don't jeopardize the health through contracting of COVID for Americans who need to access certain care.
Great. Certainly I'm in favor of telemedicine, but COVID's not an excuse for sloppy medicine. The Office of Global Affairs is the diplomatic voice of HHS. And frankly, I have a lot of concern with the World Health Organization. We need a strong World Health Organization, but I think they've lost their way. I think they've helped cover up the origins of this virus, and there's so much we could learn from getting access to the original records, going back and understand how this virus is mutated. They probably have 20 years of data studying bat dung on what this virus has done, would help us prepare a multivalent vaccine for the future. But instead, the World Health Organization appears to be working for the Communist Party of China. Do you support us getting back in the World Health Organization? We give 24% of their budget, but yet they've not become they're not being a good friend to America or the rest of the world right now.
Senator, thank you for the question and for expressing your concerns to make sure that if we're going to be involved in these international organizations, that there is value not just for us but for everyone. What I can tell you is that President Biden has made it very clear he's committed to getting back into the World Health Organization. At the G7 meeting that just recently occurred, HHS was represented so we could try to move forward to try to deal with COVID beyond our borders, because our security, our economic, our health security really depends on not just controlling COVID within our borders, but outside our borders. And so it is important that we engage with our community global partners as best we can. And we, as you said, we make sure that everyone is held accountable, not just the U.S., but everyone is held accountable when we participate in these global bodies.
Okay. Lastly, I believe with all my heart that we can have herd immunity from this virus in April or May if the president and his team, you, do your job and governors do their job. There's incredible news coming out this last week that the vaccines after one shot are 75 to 80% effective. We've already given 75 million people vaccinations. We'll have 90 million vaccinated by the end of this month. This country has the capacity to do 3 million flu vaccinations a day. We do that every year. We can give 3 million the COVID virus vaccinations every day. That should put us over 150 million people by the end of March. Now, many of us think that 25 or 50% of Americans have already been exposed to the virus, have had the virus. So I think that it's feasible to have herd immunity in April or May. And I know that you're not going to promise we can do that, but if we don't have a goal to achieve what others don't think we can do, we're not going to ever get anywhere. What would be your goal to have herd immunity? What time frame?
Senator, great question, and I know this is something near and dear to you. I think President Biden has been very clear. He's going to push the limit in making us get there and do it safely. That's why he said before he even took office and knew what he was inheriting that his goal was to have 100 million shots in American arms within the first 100 days. But if these trends continue, as you've just mentioned, that does bode well for all of us. And so we're not going to give up. The president has now secured another 100 million doses of vaccines. So we are now on course to have the 600 million vaccines, and you're talking now about 2 shots, so enough to cover every adult in America with the vaccine. And so I hope what you've just articulated is where we're going, because if that's the case, then not only is the health of America going to improve quickly, but our economy will as well.
100 million in 100 days is not acceptable. That we can get there by April or May if we do our jobs. So good luck, and we're here to put wind beneath your sails as we go forward. Thank you.
Thank you. We look forward to that wind beneath our wings.
Senator Burr.
Thank you, Madam Chairman. Thank you for holding this hearing. General, thank you for taking over 2 hours of fire from every member of this committee. Madam Chairman, I'm going to submit my questions for the record. No sense in taking up any additional time. But I would like to conclude by saying this. If we don't handle COVID correctly, we're going to see the most dramatic demographic shift in America, and you and I may not be claiming the successes of our state because they may be in far-flung rural areas hunkered down and operating off of the internet in some fashion, Zoom or WebEx or something. If we don't get our kids back in school, you know what? We're not going to grow the talent that we need in the future. And, you know, the jury's out whether 1 year interruption or 2 years interruption kills a whole generation. None of us know the answers, but we ought to be doing everything we can to minimize that today. Last thing, if we don't learn from what we've gone through, if we don't learn from our experiences with COVID, make the changes we need to, reauthorize the things that worked, plan on other zoonotic diseases that could jump to humans, and really invest in companies that can develop the technologies that make vaccine production even shorter than what we've seen with COVID-19, then I will assure you this will be devastating to our children and our grandchildren. We may not be here as legislators, we may not be here as citizens, but our children and our grandchildren are counting on us to make the right decisions. So I am convinced that the table has been set. And the question is, will we collectively go to that table and handle some very tough issues? So, General Becerra, I thank you for being here. Chairman Murray, thank you for holding this confirmation hearing, and I look forward to working with you when we can get, well, actually, I'll see you tomorrow, and then I'll work with Ranking Member Crapo and Chairman Wyden to see when your nomination goes to the floor. Thank you, Madam Chairman.
Thank you very much, Senator Burr. That will end our hearing for today. I want to thank Attorney General Becerra for joining us to talk about how he's going to work with Congress to end this pandemic and help people get quality, affordable health care and root out systemic racism in our healthcare system and tackle many challenges facing our families and patients and healthcare workers today. I want to thank all of the members of this committee for participating. Given the continued urgency of this pandemic, I hope the Senate can work together to confirm Attorney General Becerra in a quick bipartisan way. For any senators who wish to ask additional questions of the nominee, questions for the record will be due by Wednesday, February 24th at 5 p.m. The hearing record will remain open for 10 days for members who wish to submit additional materials for the record. And on Thursday, February 25th, we will convene in this room at 10 a.m. for a hearing on the nomination of Dr. Vivek Murthy to serve as Surgeon General and the nomination of Dr. Rachel Levine to serve as Assistant Secretary of Health. The committee stands adjourned.